Assalamualaikum, my name is Gunbagari, and I'm one of the organizers here at the conference. I have the honor of introducing the next session and moderating for you guys. So left to right on stage right now is Dr. Henry Chu, Dr. Shuchi Khosla, and Dr. Nafisa Sekandari. We're going to begin with a session that will be co-facilitated or co-led by Dr. Chu and Dr. Khosla. So I have the honor of introducing them. So I'd first like to introduce Dr. Shuchi Khosla, who's in the center here, who's a sweet friend of mine, and we are together on the education team at the Institute of Muslim Mental Health. She is a psychiatry resident at Michigan State University and has a particular interest in the dual burden of mental illness and intersectionality. With Dr. Khosla will be Dr. Chu. Dr. Chu is a fourth year in his psychiatry residency at Michigan State University with a subspecialty in child and adolescent psychiatry. Awesome. So without further ado, I'd like to bring you guys up here. Please give them a round of applause.
Since we're both speaking together and he's the smaller one, I'll give him the mic, but can everyone hear me in the back? So we'll kind of walk through a few slides and we'll go back and forth and we'll save the questions for the end once everything's over.
Okay, so this is just a brief slide. I think that for those of us who work in mental health, we have the DSM diagnoses, but to the community, a lot of times things that are not disorders can be concerns that you want to bring up to a mental health professional. So those include LGBTQ issues, self-harm, suicide, for the younger population, refusing to go to school for kids, bullying, cyberbullying, and as a child psychiatrist, often, the big complaint from parents is that their kids are coming in with pretty aggressive behaviors. So, not necessarily disorders, but they can sometimes obviously coexist.
Next one here. Most times patients will come, people will come, generally parents will come and say, does my child have a mental illness? Obviously, you need to be a provider to diagnose it, but there are some warning signs which we can make them aware of. So mental illness, if we define it, is problems with thinking, feeling, and behavior that get in the way of person's day-to-day life, which is causing impairment. So every person's experience with mental illness is different, but here are some of the warning signs. And the child doing there is not a warning sign, she's just being cranky. Social withdrawal, sadness or low mood, excessive worrying, kind of like anxiety, feeling nervous on or edge, poor attention or focus, poor impulse control, difficulty getting along well with others, severe anger and aggression. We know that mental illness can cause problems both for the children and much larger for the families itself. And remember, they can range from mild to severe. So just because it's mild doesn't mean that it isn't there. So if you do see the warning signs, or if your patients are, if you're a provider and your patients see these warning signs, the parents see these warning signs, please tell them to get looked at. Important also to be remembered that not every mental illness is long-term. It can be short-term or long-term, and even if it is long-term, there's managements that exist both times. The next question then is, I see these warning signs, does my child actually need treatment? So the first step to that would be assessments. Now, these assessments can be made by a variety of people, and sometimes people who are not MDs are not really aware of all the different options that they have. So I put them here for everyone to see. So yes, a child and adolescent psychiatrist can do the assessment, a general psychiatrist can do it, your primary care physician can do it, a nurse practitioner or an advanced practice nurse can do it, physician assistants, psychologists, case managers, social workers, and also board-certified behavior analysts. Now, who you will actually see for an assessment is unfortunately determined by your child's insurance. So if you had like a Medicaid or a PHP, then your primary outlet would be different from if you had like a private insurance, and we'll talk more about it as we go. So then the next step is, you've seen this, you're seeing the warning signs, and you think that your child needs help. What should you do? Now, I broke them up in two parts, and that's exactly how we look at it. If it's an emergency situation, if you think your child or adolescent is at harm, or if you think they will harm anyone else around you, don't hesitate, don't wait a second. And I know sometimes as immigrants and as minorities, that's not our favorite number to call, but do it. Call 911, they will come in and they will provide you, first, an access to a suicide hotline, and two, an access to a place that is safe for you and your child. If you're in a non-emergency setting, the steps are usually different, and again, it will be divided based on whether you have a commercial insurance, whether you have Medicaid, or whether you have someone who's like an immigrant or a refugee, they're new to the country, or they have no insurance at all.
All right, so we'll start with what if my child has commercial or sometimes called private insurance. Usually the first step would be to check with your insurance company, ask for their behavioral health coverage. If you have a primary care doctor, you can often go to them and ask for a referral. You can also look for local CMH or community mental health centers. Just because you have commercial insurance doesn't bar you from getting services from CMH. If your child, for example, has what has been determined to be a serious emotional disturbance, they can still qualify for services. And also, they can even apply for Medicaid. Again, even if their parents have commercial insurance. So Medicaid. So what if your child or your family has Medicaid? It is state funded, and so it's oftentimes dependent on the state. So you really do have to check with your individual state to look at what behavioral health or mental health services are going to be available. But oftentimes there will be, I've not heard of them called anything besides CMH. They could be. But there should be some type of community mental health center that the government contracts through, and the types of services that they provide include psychiatry, which is different from psychology, that we often prescribe medications, case management, obviously psychotherapy, ABA therapy specifically for autism spectrum disorders, crisis services, and respite. So this is just an example of how it works at our CMH. There's a central access. There's a central access number that you call. They'll do a brief screening over the phone, and then there's you follow up with an assessment, usually by a social worker, and then once they determine, there's a score that they sometimes use. They'll determine what types of services that you or your child qualify for. And in Michigan, we use the CAFAS, Child and Adolescent Functional Assessment Scale. It's a tool that you can purchase, or CMH purchases. And the assessment will look at these components. For the child, looking at their school.
Our environment coupled with parental stress, today's parents are dealing with more stress than they can handle. So this kind of stress can negatively impact parenting. When we're stressed, we become more reactive, more impatient, more aggressive, all while becoming less understanding, less tolerant, and at times physically and emotionally abusive towards our children. So kids will continue to make mistakes, be loud, be needy, be demanding, but our emotional state of mind is going to determine how we're going to respond to them. When we feel supported, loved, and cared for, we in turn can be supportive, loving, and caring towards our children. When we're lacking in getting our own needs met, we can't fully be present to best meet the needs of our children. So, as much as I don't like Dr. Phil, he has the sayings called, he has the saying that there is no reality, there's only perception. I do agree with that in life, it really isn't what's happening outside of us, it's how we're feeling on the inside that's going to determine how we react and how we interpret the situation, correct? So, for example, do you remember being so happy in your life, whether it was getting a promotion or falling in love or winning a ton of money or inheriting money, whatever it was, that you noticed nothing bad that day? You were high as a kite, you're walking down the street, you saw smiling people looking back at you, you didn't see the homeless people, you didn't see you didn't see anything negative, you didn't see the garbage on the street. So because you were in such a heightened level of awareness and so happy at that moment, you didn't see anything negative. The same can happen to us when we're not feeling very well, when we're really down and we're stressed. When we are stressed and we're not taking care of ourselves, we end up focusing too much. We're hyper-focused on all that's negative, and we look for the fault finding and the zero in on what's wrong in a situation. So when we're happy and we're fulfilled, we become expansive in our perception. But when we're lacking or running on empty, then we are, just like I said, hyper-focused on all that's wrong in our lives. We tend to generalize and catastrophize. So an example I can give you is I often hear parents come into me and they're like, my kid is awful all the time. He's always messing up. He's always doing this. And it's just painting this wide brush about all the bad things the kids are doing. But when I ask them, okay, for the next week, I want you to do nothing else but just watch what the kid is doing and document for me how often, to get a baseline, how often the kid is misbehaving, or pick a target behavior that you want to focus on and then just document how often that child is misbehaving. And they're shocked to find out that more times than not, the kid is actually behaving well. They might be misbehaving or having a tantrum a couple of times a day. Where in their mind, when they're hyper-focused on the negative, that kid is messing up all the time, all day long. So they're missing those key opportunities to actually shape the behavior by guiding the positive behavior instead of hyper-focusing on the negative. And then I have also noticed that sometimes we trigger our own children into misbehaving due to our tendency to constantly find fault in their behavior. And then the children complain that my parents don't really have time for me, all they're doing is telling me what to do, or just yelling at me about things that I'm not doing. So the children are very perceptive. They will watch their caregivers. They will see if they're having issues, if there's marital strife going on, if there's mental illness going on. So they're sensing what's happening, whether they have words to explain it or not, they are sensing what's going on. So it's really important to focus on your own mental health and your own happiness so that you can be a good role model and a good parent for your children. So managing your own stress and reducing your stress for your children can mean a happier and healthier home for your kids. Oops. I'm so sorry, I'm not coordinating this. So we know that parenting is difficult. We know that for most jobs that we get training, but we don't get that kind of training for parenting. We don't take that time to educate ourselves. What are some good things that we can do? What are some best steps to taking care of ourselves and appropriately training our children? But the most important thing, I think, comes from actually caring for ourselves. When we feel supported, when we feel balanced, when we feel whole, we can be there for our children. And I do see parenting as a verb and not a noun, and that you have to take action. If you see that something's not working, I like this concept of lettuce parenting, or like gardening, where if you're growing lettuce, you're not going to blame the lettuce for not growing well. You're not going to blame the lettuce for not blossoming the way it needs to. The lettuce is going to do what it's doing if the environment is conducive for that. You would go and check the soil. You would make sure you're watering that lettuce. You're going to make sure that there's no bugs eating the lettuce. You're not going to yell at the lettuce. You're going to change the environment. And that's what I think we need to do, is focus on, okay, if things are not working, if my child is misbehaving, if my child is acting out and not happy, what's happening? How can I change that environment? What do I need to do? And sometimes it might be looking at yourselves and changing what you're doing and how you're reacting to that child. But also, I hate the fact that in society it tells us that taking care of ourselves is selfish. There's nothing selfish about taking care of ourselves. When you get on the plane, they tell you, in case of an emergency, put that oxygen mask on yourself first. Initially, when I was a new mom, I was like, no way, I'd want to save my child before I'd want to save myself. But I know now that saving myself first, to putting that oxygen mask on myself, increases my child's survival rate. Because if I'm alive and I can take care of that child, then that child has a better chance to survive. So taking care of yourself is not selfish. Self-love is not selfish. It is not arrogance. It's actually, when somebody has self-love, they don't need to go and tell the world about how much they love themselves. That's actually the opposite. That's when people are constantly bragging and being conceited, that's the sign of insecurity and not feeling like you're enough, so you need that validation. But when you have self-love, that doesn't equal, that's not being selfish. And having a healthy family, having a healthy you means a healthy family. So we've all heard the term, if mama ain't happy, ain't nobody happy, right? That's so true, because when you're not, or even when dad's not happy, nobody's happy. Because when the parents are too stressed to take care of themselves, they keep constantly just doing what they need to do and not taking that time to take care of themselves, they're not they're not creating a healthy environment for their children. So it's really important to focus on that. So self-care can be a lot of different things, but it must include balance. So I know during self-care, we don't always get to meet the emotional needs of everyone in the family, but it is important to make sure that everyone gets to be focused on and their needs are addressed, just not at the same time. So, oops, what did I do? So the focus for this is emotional balance is an internal job. We need to do the work. We need to make sure we're focusing on our needs. We need to make sure we're taking the time to de-stress, to find time make family connections, make sure we have genuine connections in the community, make sure that we're seeking mental health support if we need it. If you think that you're hiding your marital problems or your emotional problems or mental illness from your children because you're acting like everything's okay, you're not. The kids, like I said, are very perceptive. So if you need mental health support, seek help, talk to somebody. But if you need to just take a day off, or if you have the flu and you want to just rest and have the family members take care of you, do that. If you need to go work out and exercise, if that makes you feel good, make sure you do that. Take time for yourself, read. It's not just about building yourself spiritually, but also do fun things. Watch a movie, read magazines, listen to poetry, go for a walk, go hiking. So all of that is taking care of yourself and making sure you're putting yourself first. Now on my website, drsekandari.com/self-care, I do have a guide of self-care if you guys wanted to download it. So it's on there if you wanted to get some ideas on what to do. But I do want to stress the fact that we all need to take care of ourselves. We need to make sure that we are balanced emotionally so we can be there for our kids.
Thank you so much to Dr. Sekandari, and can we get one more round of applause for all three of our panelists? And move on to the Q&A portion now. So I encourage you guys to write questions, thank you, on the note cards that are in front of you. Our sweet Akila will be coming around and grabbing them, so just wave her down if she doesn't grab your questions. Feel free to put a specific name of a panelist if you want to direct the question towards them. So we already have a few questions. How can children return the favor in addressing our parents' mental health needs when they haven't taken care of themselves? Hashtag returning the favor.
I don't understand that question. How can they return the favor?
I think it's how can you help your parents who are struggling with mental health issues take care of their needs. But I guess it's double-faceted in that when they're trying to take care of themselves too.
Right, I mean, I think that depends on the age. If they're little kids, obviously you can't expect them to return that favor, but if they're adults and they're like, well, my parents never gave me the self-care or the love or the whatever that I needed, how can I turn around and give that back to them? I think it starts again with you. You might have some emotional needs that you need to take care of first. Focus on meeting those needs, going to seek therapy, learning better coping skills, and then once you're whole, then you can give back again. I think the theme of today for my speech is filling your cup. When you're dealing in life with an empty cup, you can't really, you're going to feel resentful, you're going to feel angry. But if you're taking care of yourself and you're filling your own emotional cup, then your cup is overflowing and you can easily give to others without feeling depleted yourself. I hope that answered the question. If not, let me know.
I think it was that, and including how do they help their parents seek mental health who may not be pursuing it themselves. I don't know. I don't want to.
I think I have a tiny addition to that. I think there are two things which we can do. One, I know we always.
I think there are a couple of different things we can do. One is a little something we can always do at home that we call cognitive reframing in psychiatry, but it's really easy to do. It's very easy to talk to your mom and dad, and I do it with my parents all the time. You know, when they're focused and when they're stressed, but they're trying to make things happen for you, and they're like, you know, my feelings aren't important, or what I'm doing is not important as long as you're okay. It's okay to take a minute to sit down with them, give them a hug and be like, Mom or Dad, I'm here for you, and I see that you're stressed. How can I help you? And sometimes just that little 1 minute of sitting them down and asking them how you can help them can go a long way. It kind of reframes their thinking of their role as a protector provider and that they have to do everything for you to thinking, well, you know, maybe they're old enough that they can help me. The other part is go to them to their PCP appointments. If you think that they need mental health services, every PCP at every appointment will ask them, are you depressed? Have you been sleeping okay? Have you been eating okay? And they will usually, if they're anywhere close to what my parents are, who moved from India not too long ago, they will gloss over those questions without thinking about it. Go to them with their PCP appointments and help them answer those questions correctly. Bring up the concern to their provider so that they can then go ahead and deal with it. Because a lot of times we can ignore the symptoms, but things like depression and things like suicide are as prevalent among our families as it is with any other families or places around the world. So I think being cognizant of that.
I just want to add that unfortunately there's such a stigma towards mental health treatment in our communities, and I know with my own family I cannot get them to go seek help if they needed it. I mean, we left Afghanistan during the war, and I did my whole dissertation on this, the effect of war and migration on Afghan parenting, because a lot of them, even the people I interviewed for my dissertation, refused to acknowledge that there was any trauma, that they were dealing with any depression, that there was any mental illness. It was like, oh my God, you guys left your country, you left everything you had, and you're telling me you have no emotional issues concerning that. There's that survival guilt that's been so well documented amongst the Holocaust survivors. That happens with families as well. So it is difficult to force your parents to do that, but I think setting that good role modeling and taking care of yourself. And the martyr complex with mothers is very, very common, where, like you said, as long as you're okay, I'm fine. Just giving them that opportunity that I'm here for you. You don't need to do that. Let me do that for you. Let me ease your life in any way I can. But I think, again, when your cup is full, you can be there for your family, but when you're struggling yourself, it's very difficult to be there for them.
Thank you. So the next question was phrased, I just want to make sure I understand correctly. So if this was your question and I'm not reading it in the way that you intended, then please stand up and correct me. Can you guys please comment about taking advantage of Muslim therapists with sliding scale or organizations like Khalil Center or Iman who offer mental health services for low cost or no insurance?
Absolutely. So every step is the first step. And I know we kind of focus more on the primary care model, but yes, there are tons of services available in your community. So that would be the first step. If you're dealing with a mental health issue and you think the most comfortable person for you to talk about it would be somebody in your mosque, if your mosque has or your local Khalil Center, if they have access to any kind of resources, that would be the first step to go there. Unfortunately, there's no national data or like registry for this, wherein we could probably give you resources of yes, you could go, or is there one that I'm not aware of? I think the one that I'm most aware of is our directory that we have at the website. The Institute of Muslim Mental Health has a provider directory. All Muslim providers and the providers who take courses of being culturally competent providers are registered there. So these don't just include like psychiatrists, they also include psychotherapists, social workers, also registry for imams who get trained at our trainings which we have every year, and plus we go different places, so we always have it at the conference, and sometimes we'll set them other times during the year as well. There is a registry at the website for them, so you can go ahead, look them up, and then you know that that's a resource